welcome to our new webinar, to the new session of our webinar, Meet the Stalwarts. We know that today, on International Day of Happiness, we have a very important topic which is quite related to our happiness. And that too coming from none other than the stalwart of our stalwarts, and Dr. M.K.C. Nair, sir. So without further ado, let us go to the inauguration ceremony. For the welcome address, may I invite Dr. Rukmini ma'am, President IAP Trivandrum.
Good evening, everybody. Respected IAP Kerala State President, Joe sir, Secretary IAP Kerala Krishna Mohan sir, Dr. Renchit, AHA Kerala Chairperson, Dr. Deepa Janardhanan, AHA Kerala Secretary, Dr. Geeta Patel, Chairperson for the day, the Speaker, MKC sir, Dr. Shimi Paulus, the President-elect, Vijay Kumar sir, our immediate past President, Dr. Balachandra, good evening. And it is a privilege and a real happy feeling from IAP Trivandrum being selected as a district branch to conduct this prestigious webinar, Meet the Stalwarts. And IAP Trivandrum is all the more happy because the speaker is our own MKC sir. He is my great teacher. And if you ask anybody in Trivandrum, the same words will be repeated. He is a great teacher and we are all students of MKC sir. And I have the blessing of being his student in the UG and the PG days. So I welcome all the dignitaries named above for the webinar, and a special welcome to MKC sir and the chairperson of the day, Dr. Geeta Patel. And IAP Trivandrum is doing many of the agendas from the Synergy, our Joseph's agenda for this year, and we are trying to cover almost all the points. And we had a meeting in which we were concentrating on adolescent health, and we did a Tuesday series on that. Dr. Renchit was the speaker and it went on very well. So we are all the more happy to host this meeting, and I welcome all the audience. I understand that MKC sir is a well-known person, and because of him and also because of the topic, there are many members who have joined. I welcome all the members for this webinar. Once again, on behalf of me and behalf of IAP Trivandrum, I welcome all of you for the meeting. Thank you.
Thank you, ma'am. For the presidential address, may I invite the dynamic chairperson of AHA Kerala, Dr. Renjit P. sir. Over to you, sir.
Good evening, respected Dr. M.K.C. Nair sir, my teacher and past AHA and past national president of Central IAP and past NF president, and respected chairperson of today's CME, Dr. Geeta Patel ma'am, national AHA chairperson elect, the vibrant president of IAP Kerala, Dr. Joso sir, president elect Shimi sir, immediate past president Vijay Kumar sir, EB members, Dr. Bala sir, Dr. Anil sir, and the dynamic team of Trivandrum IAP, Dr. Rukmini ma'am and Dr. Beno, and my dear AHA OBs, Dr. Diva ma'am, Dr. Cheda, and respected seniors who joined all from all over the country, and dear friends. It's our proud and privilege that today, being the International Adolescent Healthcare Week, our respected MKC sir, the teacher of teachers, who is going to give us the talk on the Meet Stalwarts session. The Meet the Stalwarts session started last year, inaugurated by the respected MKC sir itself, and first talk was by our respected Saudi Baba ma'am. So we are planning to have a thrice monthly, every 3 months we have a doyen of in the adolescent health. We're going to give a lecture on the prominent topics on the adolescent health. And this year, AHA Kerala had already released 3 modules, one on sexual and reproductive health module, and module on relationships, and third one is the exam stress module. And AHA Kerala is planning to have come with parental guidelines for various adolescent health topic. Last 2 years, under the leadership of Dr. Shibu, K.K. sir, and Diba ma'am, and all our team, we had released about 11 modules in the last 2 years about various adolescent health activities. And we are going to continue these activities with the help of the central IAP and the central AHA. So I'm very happy that the MKCSR is going to guide us in this year also. So thank you all the respected seniors who joined for the session, and we are going to do so many activities in this week, various branches in the adolescent health week. Thank you. Jai Hind, Jai IAP.
Thank you, sir. We are honored by the presence of our State President of IAP Kerala, Dr. Joe Sir. May I invite sir for addressing the gathering?
Thank you, Dr. Seda. Respected Chairperson of today meeting, the AHA Chairperson, Dr. Ranjit, our teacher of teacher, and today the faculty, Professor M.K. sir. Today the Chairperson, my co-EB, National EB for twice, Dr. Geeta Patil, Madam, and President of IAP Thiruvananthapuram branch, Dr. Rukmini, Dr. Secretary, Dr. Beno, immediate past President of IAP Kerala, Dr. Vijaykumar, President-elect, Dr. Shimi Paulos, National EB member, Dr. Bala, Dr. Annie Wilson, and the Secretary of this AHA chapter, Dr. Deepa Janardhan, and all the senior faculties joined from Kerala and outside Kerala, and international faculty delegates are joined here. It is a great proud privilege for IAP Kerala is concerned. Today, we have none other than our MKCSR to talk on a very common issue in our community is concerned, premarital counseling. So the AHA chapter is doing a wonderful job last several years. They are prepared already. Dr. Ranjit has mentioned they released so many modules this last year. This year they are already released 3 modules that will be very well appreciated by all the IAP members and general practitioners of Kerala is concerned, outside Kerala is concerned. I take the opportunity to congratulate Dr. Ranjit, Dr. Deepa Janardhan for a wonderful job doing the last several years. This year 3 modules are released, and for as a president of IAP Kerala, I congratulate both of them regarding this preparing the module and all. The AHA chapter is concerned that last year itself we had a meet the Stalwarts. They are conducted a lot of programs. We start with the Sangeeta Yadav madam. That was inaugurated by none other than our MKC sir. Today we are going to have another important topic, premarital counseling, by MKC sir and chaired by Dr. Geeta Patel madam. And I think this program is useful for the practicing pediatrician to how to tackle the issues in the community is concerned. And I think this will be very useful for all of us regarding the counseling part of premarital issues and concerns. And with this said, I wish you all the best program. Jai Hind, Jai Hind.
Thank you, sir, for your kind words. Now, may I invite Dr. Shimmi Paulos, sir, President-elect of IAP Kerala 2024, for the felicitations.
Good evening, everybody. Respected Chairperson of AHA Kerala, Dr. Ranjit, the State President, Dr. Jose, the faculty, the esteemed faculty for today's talk, MKC sir, Geeta madam, who is the chair, who will be chairing the session, the other members of who are on board the Zoom platform. A warm evening to each and every one of you. Definitely, premarital counseling is the need of the hour. As I think so, statistics show that we have a lot of divorce cases now. So premarital counseling, it should have been started early, I feel. The Christian law, as in Kerala, we all have to go through a premarital counseling. Then only you get a certificate to get married. When I was getting married, it was the same story. I had to get a certificate from the premarital counseling was there. But the things that they go through are only on spiritual part, the bit of your the medical part, that is especially the reproductive system as such, and a thing about the Bible and all that. But I think so premarital counseling should go beyond that also. So even I think so people who have attended that also could may end up with the divorce cases. So the understanding of one and another is the most important thing, giving space to each other, and that is the most important thing that we are facing through. So definitely this premarital counseling, going out and reaching out to others, and especially to reaching out to the early, that is in the adolescent age itself, if we can impart this information to them, then later on I think so many of these issues can be tackled. People will be more understanding also. Anyhow, AHA having taken up this program, and with especially with our renowned speaker and the person who's right behind this topic, with MKC sir, I think so we can really do wonders, and we should also be able to reach out to the adolescents and all. Once again, congratulating AHA for their activities, and also congratulating the Trivandrum branch for taking up this program. Wishing the program all the best. Jai AP, Jai Hind.
Thank you, sir. Now may I invite Dr. Vijay Kumar sir, immediate past president of IAP Kerala, for the felicitations.
Respected MKC sir, respected Geeta madam, and all the stalwarts of IAP Kerala, Dr. Jose, Dr. Krishna Mohan, and AHA Kerala, IAP Trivandrum, all the best for this program. Actually, this Meet the Stalwarts started last year, and we know that even in the beginning we have COVID problems, and even after that it continued very well. And for the past 2 years, they have AHA has come out with so many modules which are relevant for the year and relevant for all the family members and the students. And now they are coming up with premarital counseling and other important areas in adolescent. And last year, Adolescent Health Academy of Kerala has bagged the best subspecialty chapter award also. So I wish all the best for this program. Jai Hind and JIAP.
Thank you, sir. Now may I invite Dr. Balachandra sir, respected EB member of Central IAP, for felicitations.
Thank you, Shweta. Our respected Dr. Ranjit, our speaker today, PC sir, our IAP presidents, the past, present, and future, Dr. Jose Vijaykumar sir, Jose, and Dr. Shimi, our IAP office bearers, Dr. Rukmini and Dr. Beno, my co-EB, Dr. Anil Vincent, our AHA secretary, Dr. Deepa, our ECSG EB members and chairperson today, Dr. Geeta Patil ma'am and Dr. Adil Gupta, friends. Today's second meeting I'm attending as the EB member. Incidentally, this IAP Trivandrum, I attended the first at Trivandrum itself physical meeting, and today the online meeting, both from IAP Trivandrum. And AHA has been doing an excellent academic activities on since Ranjit and Dr. Deepa has taken over. The last 2 years, I've seen a lot of modules being released. I'm happy that they have started today well with a very important topic, as well as very important, equally more than that, a very important speaker in MKC sir, who is well known nationally and internationally for speaking on this important topic, premarital counseling. As Shimi said, this is a very important topic, and this should go beyond religion. I think everybody should have a premarital counseling before marriage. That's the most important message. I think we should convey that. And one more important thing is tomorrow we have the World Water Day. Today is the International Forest Day. ECSG is having a talk at 9 o'clock from our Andekshan sir, is the president, chairperson of the chapter of the group, ECSG group. I request everybody to attend tomorrow at 9 a.m. through Zoom. And all the best for this program. And I congratulate once again IAP Trivandrum for taking up this important activity. Thank you. Jai Hind, Jai Hind.
Thank you, sir. Now may I invite Dr. Anil Vincent sir, respected EB member of Central IAP, for felicitations.
Thank you, Dr. Shweta. Good evening, one and all. Respected dignitaries on this Zoom platform, my dear friends. Premarital counseling is a topic we often think of or consider just before marriage. As Dr. Shimi has rightly mentioned, different religions have their own structured courses and logistics for the same. And for us, the Christians, we have 3 days course, usually arranged in the local parish. And I congratulate, on this background, I congratulate AHA for taking up this topic for adolescents. Definitely, they will have a clear view of the upcoming disasters and tsunamis, much earlier. Today's children, I would like to call them e-children for everything they Google in the internet. And definitely, internet is a good source of information, and there are a few misleading contents also. Sex education is a topic forbidden in curriculum. Introducing these topics are the need of the hour, and it's easier to catch up human brain before they divert to different directions. And today's topic is the need of the hour, and we are lucky to have our MKC sir who can do wonders on this topic. And I congratulate IIP Kerala, ASA, and IIP Toronto for this venture. I wish all the best for this program. Thank you.
Thank you, sir. Now may I invite the vibrant secretary of IIP Kerala, Dr. Krishna Mohan sir, for the felicitations.
Respected State President, respected Chair of the Day, Dr. Ranjit, Office Bearers of AHA, and most respected Teacher of Teachers, MKC Sir, Geeta Patil Madam, and all the respected delegates. So I take this opportunity to congratulate AHA for their wonderful activities, which is happening all around the year. And last time also they won the Best Branch Award. So I'm sure this year also they will repeat the history. So I wish all the best to this program, and thank you so much.
Thank you, sir. To deliver the vote of thanks, may I invite Dr. Benno Andrew, Secretary of IIP Trivandrum.
Thank you, Dr. Shweta. First and foremost, it's indeed my proud privilege to have been asked to propose the vote of thanks on behalf of IIP Thiruvananthapuram. Firstly, I would like to thank our beloved State President, Dr. Jose O, our vibrant Secretary of IIP Kerala, Dr. Krishna Mohan, AHA Kerala Chairperson, Dr. Ranjit P, AHA Kerala Secretary, Dr. Deepa Janadharan, our IIP Trivandrum President, Dr. Rukmini K, and my heartfelt, sincere gratitude towards Teacher of Teachers, Professor Dr. MKC Nair sir, for presenting such an important topic of premarital counseling, which is indeed the need of the hour. Thank you, sir. And my sincere thanks to Dr. Geeta Patil Madam, who's the chairperson-elect, CHA. Thank you, Madam, for chairing the session. And I would like to thank Dr. Shimi Paulo sir, Dr. Vijay Kumar sir, past President Balachandran sir, Dr. Anil Vincent sir, and again thanking Dr. Ranjit and Dr. Deepa for the various modules of our lesson module which they have released. This is indeed going to be useful for all the practicing pediatricians and for also the PGs. And thank you all once again for giving us an opportunity for presenting this important topic in this platform. Thank you all.
Thank you, sir. With this, we come to the end of the inaugural session. Now we move on to the much awaited scientific session. And to introduce the chairperson of our day, may I invite our dynamic secretary of AHA Kerala, Dr. Deepa Janardhanan, ma'am. Over to you, ma'am.
Thank you, Shweta. Respected seniors, dignitaries, and my dear friends, I feel blessed to have MKC sir today with us today as a faculty, being the second day of International Adolescent Health Week. Really happy to have you, sir. And today I'm privileged to introduce the chairperson of today, Dr. Geeta Patil Madam. Madam is a senior consultant pediatrician, adolescent health specialist at Bangalore. She has been the president IIP Bangalore in 2017, where she received the first prize for Best Branch Award. Madam has been the vice president Karnataka IIP in 2021. She has been a CIIP EB member during 2020 and 2022. Madam is the Central AHA President-elect 2023. Madam has been the Joint Organizing Secretary of National Pedicon Bangalore 2017. She has been the Chief Organizing Chairperson, National Adolescent Bangalore in 2019. She has also been the Organizing Secretary of South Zone Pedicon during 2020. Madam has been given the FIAP Award in 2021. Madam has got 14 publications to her credit. She has been a faculty in various local, state and national conferences. Madam has been a very active member in IAP potential action plans like NCECT, NTEP, WAR, STEVER, NEPU, MSU, MKU and whatnot. Extremely happy and privileged to have you here, ma'am. Over to you, Geeta Patil, ma'am.
Thank you, Dr. Deepa. I am audible?
Yes, ma'am, you're audible.
Okay, good evening to everyone. And thank you, Dr. Deepa, for your kind words. And Dr. Shweta also, the way she has conducted the inauguration function. At the outset, let me thank IAP Kerala President Dr. Jose, Secretary Dr. Krishna Mohan, President-elect Shimi Polos, immediate past President Dr. Vijay Kumar, and Kerala Central IAP EB members Dr. Balchandar, Dr. Anil Vincent, and our dynamic President of Kerala AHA, dynamic young President of Kerala AHA, Dr. Ranjit, and equally dynamic and very sincere Secretary Dr. Deepa Janardhan, and host branch IAP Trivandrum, President Dr. Rukmini, and Secretary Dr. Beno Adru for giving me opportunity to be part of this such an important session. We know that Kerala AHA is always forefront in all academic activities. I think they get always awards, we know. So, and AHA, Adolescent Health Academy of Kerala cannot be exception to that. So I congratulate for them having so many modules, so many programs, and very structured way of conducting the program. Before going ahead in introducing the sir, let me first tell that 19 to 25th March is celebrated as a International Adolescent Week. So theme of International Adolescent Week this time is with and for adolescents, building healthier and more inclusive future. What does it mean? That meaningfully engaging adolescents as equal stakeholders in decision-making and agenda setting matters. And we must recognize adolescents as experts in defining their well-being. So without adolescents, we can't go ahead. What they want, what they are going to express, that is very important for us. So I'm just taking a little more extra 2 minutes to talk about this. So one of the topic of this International Adolescent Health Week is sexual health. And today's talk is definitely connected to that, premarital counseling. And we know that always we talk to grown-up teenagers, young adults. One more stalwart of our AHA, Dr. Atul Kanikar, he has written in his book, Terrible to Terrific Adolescent, he has described premarital counseling. I may not be able to tell the exact words, but what he told, knowing the syllabus and prior preparations before the examination are very essential for reducing stress and regrets later. Hope, I think maybe he has used very good words, and I like maybe a little bit I have changed the words, but this is the way he has expressed. I felt this is a very important thing for us to. So, see, we know that just now Shimi Paul sir told that there are many reasons of strained marital relationship. Main thing is discrepancy between what was imagined and what the reality is. And we know that lack of empathy between the partners is the main issue. So premarital counseling for college students can be considered parallel to family life education in schools. So let us consider like that. We can do during the youth gatherings, group counseling sessions, and we can discuss many protective and harmful factors. Many of the youngsters today, they will be daydreaming about their happy married life, how to achieve that. So by this, they can definitely have a right choice suitable for them, which will lead to a stable, reliable, pleasing, stressless married life and healthy attitude. Maybe there are certain controversial topics like investigations to be done before marriage. that sir will enlighten us about that. So whether this is going to be a more important than horoscope matching, we are going to see. And this is such an important topic which requires a structured approach. And we know, all of us, sir started talking about 20 years back about the adolescent medicine. And now we say triple dividend given by investment in adolescent health, and it has gained the momentum. It is proved by all the people from all over India. I think you can see the states. I think not a single state will be spared that they are joined, who are real adolescent ambassadors, because they have realized the importance of this topic. So let me tell about the sir. I'm not going to tell conventional his biodata. What I perceived, I'm going to tell. See, always we fondly call him MKC sir. Professor Dr. M.K. Chandrasekharan Nair, Doctor of Science, which is the highest degree in science. He has achieved that. He is a renowned pediatrician, counselor, and academician in the field of child development and pediatrics. He has authored dozens of medical books. I think I can't tell. He holds 12 degrees. I'm not describing those degrees. 12 degrees in various disciplines. And he's an academic editor for several textbooks of pediatrics. He is honored by receiving prestigious oration, Shantilal Seth Oration, Nina Sibal Award, Lifetime Achievement Award from IMA, and many more. He may be the only IAPN who has served as a president of IAP as well as president of NNM. I'm very sure no one else so far, we don't know. He was obviously a president of Adolescent Pediatric Chapter and India Clinical Epidemiology Network. He was appointed as a Vice Chancellor, Kerala University of Health Sciences. He, as a counselor, he has helped 70,000 families, and as an academician, he has given us 3 subjects, and all of us read those books. And all these 3 subjects, all of you know. One is developmental pediatric, second is behavioral pediatric, and third one, obviously,
सर आपका म्यूट हो गया मैडम.
I'm here muted.
Is it audible now?
Yeah.
Okay. Yeah. So he is a counselor. He helped 70,000 families, and as an academician provided us the 3 subjects what I told. I think mostly all of you have heard about that. And as an institutional builder, he developed the first child developmental center in Thiruvananthapuram. And he has trained more than 5,000 doctors, nurses, and other staff in various specialties. That is the way I have pursued sir's biodata. And this is the topic which none other than him can discuss. Maybe later on we all will follow, and we need to have, AHA should have this module also. Maybe Kerala AHA may be having this module, which should be taken everywhere, which is a need of the day. Apart from the religion, everyone wants to know about that. It is shown that there are so many people are on the dais now. And let me congratulate Kerala IAP and Kerala AHA for this joint program. And thank you very much for giving me opportunity. Over to Dr. MKC sir. And all of you will be keen to listen to him. Maybe I have extended my 2 minutes talk because of the International Adolescent Week. And this is the right program arranged for the International Adolescent Week. Thank you very much.
So good evening. All of you can hear me?
Yes, sir. Yes, sir.
Okay.
Yes, sir. You are.
Basically, I'm honored by all the nice words told about me. But the most important point is, somebody has to show the path. That is okay. That is important. But there has to be followers. Whether it is child development, whether it is behavior pediatrics, whether it is adolescent pediatrics, and now health of the young adults, and particularly premarital or preconception counseling. It is because all of you follow what maybe little bit have started somewhere. That is why it has becoming a Even adolescent has become a major thing in India. Thank you all for that. Now, when you look at preconceptional counseling, why do we need preconceptional counseling? Because you want to reduce the adverse health effects to the woman, fetus, and later neonate by addressing the modifiable risk factors. Researchers will look at all the risk factors, but we are interested in the modifiable risk factors, something every doctor can change. And by providing education about healthy pregnancy, joyful pregnancy, and mothers' participation in the whole program. Now, WHO had conceptualized it in a big way, starting with adolescent, not only adolescents, before adolescence also, puberty, then a pregnancy, the birth, postpartum, newborn, the postpartum health of the mother, infancy, childhood. So the whole cycle has been given by WHO and we need to follow. Now I come to the straight subject. There are 10 commandments. You can have more, but these commandments are for premarital or preconceptual health counseling. The moment you look at social, economic, so many other domains, it can become 21 also. But I am focusing on the 10, the most important health counseling issues. And this has been now very nicely given now. A book has been published on premarital counseling. It will come, it's already been released. Now let's look at what is the first one, family life and life skill education. We all started with that. Instead of using the word sex education, we shifted to a much more comfortable word called family life education. We knew that the children need life skills, so that is the important. Then we had fought for last 30 years to get the rubella vaccine free. Okay, even stalwarts of immunization at some point objected to it, but still we pursued, and now it is free of cost. And you have the hepatitis B. All of us know that although HIV is a frightening situation, the real danger one is hepatitis B. And we have the SPV vaccine, human papillomavirus vaccine. It's been there for some time. Initially, we made a mistake of linking to sexual relations or onset of debut of sexual debut, but that is wrong. Now, Academy has realized that you just project it as an adolescent vaccine 10 to 12 years. Don't bother about sexual activity or not. That's most important. Then you have preconceptional folic acid intake. Now, this is extremely important to remember that, everybody talk of folic acid intake after the person has become pregnant. No, it has hardly any use. It has to happen before. How do you convince the mother? You tell the mother that the neural plate, what the brain and the spinal cord start as a plate and then it folds itself and become a tube by 24 days. And if you don't give folic acid, there will be a hole, and through the hole, the nerve tissue will come out in the spine. Are you with me? So this has to be explained to the mother that it starts as a neural plate, which folds itself by and become a tube by 24 months. And if you don't have folic acid, you have a hole and through which the nerve tissue may come out. And why this 24 days is important? Because we know that the pregnancy occurs between two, menstrual cycle, that's ovulation, 14 days. You wait for 7 days, 21. By the time you reach a hospital, another 2 to 3 days. So by the time a pregnant woman reaches a hospital to a gynecologist, she's obstetrician, baby is already 24 weeks. After that, there's no use. That's the whole point we need to emphasize. Why before the moment marriage is fixed, folic acid has to be given. And if you are planning for second pregnancy, that also is important. Then you have a lot of body image concerns before marriage. There are cosmetic concerns, but the most important out of them will be the dental care. So we need to talk about dental care, why it is important. Halitosis is a major issue that needs to be taken care of. Then you have medical checkup. I'll come to details of all this one by one. The medical checkup, whether you have a hypertension or diabetes or something like that. In the girls, breast examination, because they may be having swellings and what to do with that. Then you need the gynecological issues, particularly an ultrasound abdomen. Mark my word, it costs less than 1,000 rupees in the biggest city also. And an ultrasound abdomen makes sure that your reproductive organs, including the ovary, is normal or abnormal. Your liver, spleen, everything in the stomach. Normally, that's the cheapest way of looking at your abdomen. Why not do it before marriage so that once she go to a new house, if she has a problem, then she suffers for that. Screening for menstrual, PCOS, genitourinary infections. We have the 7-question screening, which I'll show you later. Screening for anxiety, depression, suicidal ideation, because we want the couple to be mentally stable. Then, of course, sexuality skills. 30 years ago, if I talked about sexuality skills, everybody else glared at me and said, what nonsense? What are you talking? But now I must tell you that this week itself, I have taken 6 or 7 classes for different kind of people. Today also afternoon, I took class on this only. So when I ask about sexuality skill, most of the women say that we need it. We need it. That is a must. I'm surprised. 30 years ago, nobody would have raised hand. So that is something. Society has changed a lot for the good as well as for the bad. The good part is that they have become less shy about many of these things and they have accepted it. The bad part is a lot of people are actually giving wrong messages to youngsters, which I will discuss later, which is dangerous. Then, of course, newlywed counseling for both partners, because they need to understand each other, understand the needs of each other. And they also you may have a problem of what you call urinary honeymoon urethritis. We used to call honeymoon cystitis. Now we know it is urethritis. And what I do is always in the premarital counseling session, I'll give a slip, a small slip, in which no name of the doctor, nothing, just a small slip in which you write albumin sugar deposit. Tell her, keep it in your purse. After 2 weeks after marriage, if you have any problem, burning or something, collect urine, send with a boy to the lab. Don't tell anybody. You don't have to embarrass. And the boy won't know what it is. And you know, when you come back, if the pus cells are more than 6 per high power field, just give me a call. I will tell you the medicine on the phone, and you don't have to worry. You don't have to even tell your in-laws. Nobody you need to tell. That is important. And now the 10th one is self-counseling to develop coping skills. Now, this is an area, new area that I am working, because whatever much you may counsel the couple, unless you prepare them for understanding themselves, the self-perception of themselves, you know, unless they do that, they will not be able to live together happily. Because the problem is when there are 2 persons from different background, cultural, educational, scientific, economic background come together, impossible that there will not be any problem. There will be problem. So we are not to be scared of problem. We must prepare them to do self-counseling. I must say, all my life, I have had enough and more problem, but I never went to a counselor. I did self-counseling. So that is some new area that we are working on. If you heard me 30, 40 years ago, I would have been talking about family life education, talk about nutrition, personal hygiene, scholastic counseling, life skill education, emerging adolescent sexuality, risk-taking behavior, and supportive counseling. We have heard this many, many times. And then why second one was immunization. This picture should be shown to the public. You know, rubella is a simple disease. If you have in the school, you hug each other, let every girl get it. But if you get it at the time of pregnancy, you are sure to have a cataract, you are sure to have deafness and heart defect. So it is important that we take rubella vaccine. There is a doubt whether after that, can you get pregnant? A gap of 4 months is always good, but you don't have to worry about it. Even if you become pregnant, nothing will happen. Then talking about hepatitis B, unlike HIV, who is an innocent fellow, he'll die in heat, cold, winter, anything will kill him unless you have protection of the body fluid. Whereas this chap called hepatitis B, even if you burn him, the virus particle will be there. So we need to be careful about hepatitis B because it's the single most important cause for chronic liver disease. Then, of course, human papilloma virus. The vaccine has been introduced almost now 20 years, but pediatricians have not taken it very seriously, initially because of the cost, but now the cost is not much. It has nothing to do with, as I said earlier, it's not a sexual vaccine, it's an adolescent vaccine, which will protect your daughter from having cervical cancer. So that is very, if you look at the 3 stages, it's so important that you must give. When you have any child coming at 12 years or something, you should ask them, the girl, whether she has taken it or not. Then you have, I said about preconceptional counseling. This picture will really impress upon the school kids why they premarital counseling, they should take folic acid. The requirement is only 400 microgram, but what we have is 5 milligrams, so cheap. Even if you take half a tablet, nothing will happen. It will go in the urine. But there is also a small caution that if you have continuously taking folic acid, it may promote RBC formation and create a relative vitamin B12 deficiency. It is only a caution. It is nothing to do. In the public, you don't say all this. To the pediatrician, obstetrician, you may say that such a caution is important. Then, of course, cosmetic, most important for them, apart is the acne. And acne for an adolescent is important because they do not require any cosmetic. If they use cosmetic, do not wash it off by cleansing fluid or oil, then they will have unnecessary this one. And dandruff, again, a persistent problem. 2 things we know about dandruff. One, there is some role of fungus. Second, you have some role for anxiety, depression, psychological issues. So both has to be corrected. For this one, we can use the fluid. What is available is Nisral liquid. That is a company name, so that's why I didn't put the name. What you put it in the scalp by about 10 or 11 in the morning. After 6 hours, by 4 or 5, you wash it off. So the medicine get at least 5 to 6 hours to work on the fungus in the scalp. So that's a very good way of doing it. Then, of course, you have tooth decay. We all think that we are not there. If you are married, your wife is the best person to warn you about any potential halitosis. Immediately go to the dentist, make sure that you don't have that problem. Then, now, medical examination, so many things are there, but I think we'll talk about preconceptional care of epilepsy. Now, this is a serious topic because select the safest anti-epileptic drug. It has to be re-evaluated. The anti-epileptic drug we use has to be re-evaluated. In general, the rule is valproate is to be avoided. In a generalized epilepsy, newer anti-epileptic drug, lamotrigine, etc., carry lesser risk of fetal malformation and neurocognitive impairment. Focal epilepsy, sodium channel blockers such as carbamazepine, oxcarbazepine, etc., is preferred. Please note these 3 things. We have been working with Sanjeev Thomas in Chitra Center for last 30 years, and just recently we published a paper where whatever statement we are making is an international study. We have been working for last 30 years to show multiple papers show that the risk of congenital anomaly with anti-epileptic drug is there, but not so severe. But if you are using specific anti-epileptic drug, the most potential useful one, valproate, unfortunately is the villain. It cannot be used. Then another most important thing that is coming, I'm just publishing a book on adolescent gynecology along with the professor of gynecology. And what we have written in that, a author from Amrita, who has spent her whole life only doing breast ultrasound examination, categorically says that below 24, the chance of a malignancy is negligible, except for maybe ductal carcinoma, which can happen even in a male breast. That's a rare thing. Otherwise, there is hardly any risk, and you don't have to be worried about, the breast swelling. What happens right now is either there is immediately gone for biopsy, whole sort of mutilation. I have many stories to say, but lack of time, I am not saying how unnecessarily they get mutilated by general surgeons. It is not required. And there's no indication for doing mammogram, which actually exposes the tender young breast to radiation. So much better is to have an ultrasound. And when you, when you delineate the edges of the swelling, the sonologist can clearly say that there's no problem in this one. It's not my opinion, opinion of a person who has spent whole life on this. Now, then this is probably the first study we did on, validating whether you have vaginal infections or not. This was by Thiruvananthapuram, who was a PG at that time. We did community clinics. Community clinics looked at 425 girls, which means community clinic doesn't mean that it was a random sample. No, it was probably the people who had girls who had problem more reported. So don't worry about the proportion or percentage of problem, maybe slightly on the higher side. For example, itching over genitalia 21%, malodor discharge 19.4. What we did in this study is we took external swab from the introitus and proved what are the bacteria. And the results say that it was 96-97% Candida, and Candida. Very few Gardnerella vaginalis, and which means foul smelling, all that in adult women, and very little of flagellate things. Okay, and this is published. Now, then we have a huge problem about we have PCOS. We need to look at make sure that the girl do not have PCOS. This is an earlier study where we looked at 3,443 plus 2 girls. We did ultrasound by 3 renowned senior sonologists, different part of the city. We found 28% reported that they have menstrual problem, but out of which only 13.1% actually had it. And when we did ultrasound, we find that prevalence of PCO, not a syndrome, PCO, polycystic ovaries, is about 10%. And you look at the picture, you will see the, necklace type ring, that holes you see there. But this is seen mostly in infertile women, not in adolescents, because there are both the studies. I'll tell you, we have had 2 PhDs done, one by Sheila. I'm not showing slides of that because just getting awarded only. I didn't want to publicize before syndicate has approved it. I think I've told they have approved it. Exam is over, but it has not come officially in the papers. One is Sheila Balakrishnan, who has actually looked at 4,000 girls, young adults. She did PhD with me and proved that what she has proved is most important. Ultrasound is not a must. If you have problem with menses, you have absent or very irregular scanty menses on one side, and you have excess hair growth, that itself is enough to say polycystic ovary syndrome. Do not bother about the ultrasound so much. Why? Because when you have the follicular stage of ultrasound, you may get erroneous results that it is polycystic ovary. That is important. And from the side of vaginal infection, another lady has done gynecology, professor has just given the PhD, and that clearly says the same result that we have shown. It has shown that you don't need to. 2 things we learned from that. Around 4,500 girls, and younger girls, not young adults, younger girls in the Trivandrum area district, Anganwadi base, mother present, Anganwadi worker present, no male present anywhere there, a systematic sampling. And what we found in that one was two things. One, if you take a history by the 7 questions, that then on top of it, you have just a glance of the external genitalia by the expert, that will be diagnosed the most majority of cases. You don't have to do a swab, which is of course cumbersome, and it need not be. What we have done is, we have done this for every child who has any complaint or examination by the gynecology professor as abnormal. So take this message that just an external genitalia examination, visual inspection is enough to diagnose along with good history. Okay. And then, of course, this is the 4 things that you have obesity, you have increased hair growth, you have acanthosis, very important. And this is the most important part, the Ferryman-Galway thing. You don't have to expose these girls so much. You only have to show the picture, and 1 to 4, how much hair growth is there. They will mark it, you can score it. If you have a particular doubt about it, of course, you can examine with the permission of the girl, within the presence of the mother. Very important. Do not expose an adolescent totally, completely. You only have to take permission first. If she say, okay, I'm okay, don't believe it so much. She may still be under tension. Expose only part by part, little by little, and every time you are exposing some part, take permission again and again. Now, what is the treatment? Of course, hormonal treatment is there. What is a hormonal treatment? Actually, it's like oral contraceptive only. It prevents the ovulation. But we don't talk about that to the girls. We say it's a hormonal therapy. But before doing all that, we need to do 3 therapy. Number 1 is weight reduction. Number 2 is weight reduction. Number 3 is weight reduction. So weight reduction becomes so. Just look at this. If you have placebo, it goes into 45 angles. If you use metformin, it may come down little. But if you do lifestyle, actually it come down to 30 angle. So that means lifestyle modification is the most effective part of it. Then, of course, the next issue that we need to look at is the sexuality issues. Okay, way back, we had published this book on sexual reproductive health of young people, the only book at that time. Now, of course, many other may be available. Now, what we need to tell the kid, the premarital person, both boys and girls, is sex has 3 parts. You have procreative sex for producing baby, and if it doesn't function, you end up being infertility. You have recreation sex, which if you are doing in the teenage area, then you get teenage pregnancy, sexually transmitted infections and whatnot. There's a PhD by a gynecology professor, Sheila Mani, who did with me years ago, and which showed that if a teenage girl gets pregnant, there are 3 reasons. Number 1, 9 times more chance if the parenting is bad. 7 times more chance if there is emotional separation of the couple. And 5 times chance if you don't give age-appropriate sexual reproductive health education. Remember the rule 975. And this has really changed the whole our idea of how to do family life education, or in a bigger age group, above 24 or above 18, we can call it sex education. And the third part is relationship, which most of us don't understand. What it means is the caring part of it. We all know about love, but love is the most not an important thing. Anybody can say, love you, I love you, love you. It has no meaning. But somebody has to show that I care for you. He may never say, she may never say, I love you. But the caring can be seen in her eyes. Caring can be seen in her, the way she talked to you, the way she behaved to you, the way she handled you. That's the most important. Now, other part of sexuality, I'll just say that also. Sexuality also has physical aspect, it has mental aspect, and it has spiritual aspect. The end point of physical sex is orgasm, or in Malayalam we call Radhi Morcha, which is something Most people don't understand it, that there is such a need for that. And then you have, you have the mental or psychological part. The end point is ecstasy. Now, in the initial days of marriage, it was, I always say, akrantam, akrantam, akrantam. So you are only interested in the physical part for orgasm. But after she become a mother, your respect for her changes completely. Akrantam marita, what it becomes is that you want to show her that I care for you. And the end point of that is called ecstasy. Ecstasy is a feeling when the mother see the newborn baby. She went through all the turmoil, all the pain. And when she see the baby, she forget everything else. So that is the ecstasy. And relationship, sex, or spirituality, the end point is called fulfillment. Fulfillment do not need any physical component, need not have so much of mental component. It is much more spiritual component. That is why the elderly couples very often, if they are not fighting, then they can be very, very happily supporting each other, holding hands, no sexual activity, no big things like the youngsters do, but even just holding hands, they are the most happy couple. Now, this slide, I think all of you need to, if you want to take a photo also, I don't mind. If you want to take a copy of this, I don't mind. We need to tell the children, the couple, exactly what the opening is like. Above, you can see the clitoris. Now, clitoris is a bonsai, what do we call, we have seen the bonsai things on your top. Big tree in a small thing. It's something like this. It's a bonsai penis. It has as much nerve ending as in a penis. And so it's the most important organ for sexual stimulation. And then look at the urethral opening, look at the vaginal opening, and below, just below, you have the anal opening. So when you have the first intercourse, if you do not know all the anatomy, what happens is most of the pushing will be at the level of urethra, the upper part where you see all the decoration, and poor thing will end up having honeymoon urethritis. Okay, that is important. On the right side, you see there's no opening of the vagina of the hymen, and so you don't have bleed at all, but you have swelling, pain every month, and swelling in the abdomen. And you see the lower one where the opening is as small as the urethral opening. So the first 1 or 2 days, fluid, blood will come out, but after that, it will get clotted, clot will melt, and for next 2 weeks, she may be passing little bit. So I think both boys and girls have to be shown that this picture. Then of course you have labia majora with hair, labia minora without hair. And the critical role of what do you call the clitoris is important. Remember, I always say, when I was in the womb of my mother, the first 4 months at least, my genitalia was female, and then maleness is so imposed by the baby's fetal, testosterone or from the male organ, and that is how the clitoris become larger penis, and the two fold join together produce the scrotal sac, and the actual testis may come out only after the delivery itself. Most of them may have before, but some of them it may be still in the inguinal canal. So remember, all our idea of doing abortion at 12 weeks, saying that it's a female baby, for half of them may be male, half of them. Just keep in mind, we don't want to talk about against the national programs, but as scientists, all the radiologists will say nobody can say it's a male genitalia before 18 weeks, because you can see a penis only by 18 weeks. And before that, whatever assumption you make may be 50% wrong. Then, of course, I use this picture to tell about the male organs. In a school, you may not talk all the details. You just trace out the urethra, say how long is the urethra. And this is a very important way of doing. And if you don't want to expose, I'm not talking of premarital, but if you're talking in the school, it may be a nice idea talking about priapism. That is the permanent erection. which is so painful, so painful. So that is a time when you can say erection, ejaculation, nocturnal emission. I always say with the saliva, if you have saliva, too much of saliva, what happened? Either you have to spit it, swallow it, or in the night it will come. Same thing happened for semen. And then we use the word self-stimulation or masturbation. And 30 years ago or 40 years ago, if you use the word masturbation itself was very difficult. Nobody approved it, but now things have changed completely. In fact, the girls will say it is our right. What is your problem? Okay, that is acceptable. They can do what they want. There's nothing wrong. But is it normal or abnormal? If I say normal, the religious people will object. If I say abnormal, the medical person will object. So I am using a court language that it is not abnormal. So if you ask me, did you say normal? No, I didn't say. Did you say abnormal? I didn't say. I only said not abnormal. Now, this is something we need to teach the people, that before marriage, if you have been doing sexual activity, please, for heaven's sake, get an examination. If the girl have been doing sexual intercourse, she could be getting sexually transmitted infections, particularly chlamydia, which can lead to infertility. If it is boy, of course, both male and female, both can have herpes infection, which will come every month. And we need to be careful, because even with treatment, it just doesn't go away. So when people talk and promote a lot of in the colleges and all oral sex, I'm not for it, because in fact, Britain has made that mistake. To prevent teenage pregnancy, they promoted oral sex. In the end, they found a lot of infections, sexually transmitted infection in the mouth. Now, you don't have to be worried about HIV so much, because he is not such a dangerous fellow, because unless you are determined to get it, unless you spend money for it, unless you do exercise for that, you won't get HIV, because the percentage is in the normal population less than 0.5%. So if you are unlucky, you may have to do 200 attempts before you can get HIV. So don't worry about it. This is what I said earlier. It's a PhD project. What I said, 975 rule, lack of appropriate parental control as a lack of family relation, intra-family relationship, and adequate sexual reproductive knowledge. Now let's get the next issue is screening for mental health problems. How do you screen? You cannot go into comprehensive textbook or psychiatry to do that screening. What we need to do is three things. If the symptoms are out of proportion to the cause, you have definite body symptoms like in anxiety, you have palpitation, you have sweating and all that. If you have in depression, you have three things. Your sleep is affected, appetite is affected, your sexual interest is affected. If these three are there, in a male person, you can easily find out because of lack of masturbation, etc. Now, this I just showing a data of, maybe I'll skip this slide. Look at the prevalence of anxiety disorder in so-called normal children in a community in Kerala. Look at it. If you are using Indian scared cutoff, scared is the tool, 25%, DSM-4 criteria, 14%. Take an average, I think 15% of the population may have anxiety. Now then you have the counseling. We need to know a little bit about counseling. When you talk about counseling, the first step is building a positive relationship. Then let the person talk. That is called ventilation or catharsis. Then, why I'm bringing this into premarital counseling is there are a lot of people. Just last week also I had a person who actually had, before marriage, is scared to do it because he thinks that after marriage he cannot do it. And he has so much of guilt feeling about the masturbation. So we need to make out what are the problems. You need to sit with them and say very pleasantly, not in a, that you are one up above and they are small. No, very friendly way, equal basis. You say, what are the anxieties you have, and prioritize the anxieties. Then you see prioritize the solution that they are giving, and then you help implement the solutions. The drugs, of course, we know for all Plenty of drugs are available. Psychiatrists will write umpteen number of drugs. But as a pediatrician, we only need to know few drugs. That is fluoxetine for anxiety and depression. Anxiety 10 to 40 milligram once a day in the breakfast. For depression 10 to 20 milligram for depression dose is only half. Anxiety you need more. ADHD, of course, atomoxetine. ADHD will not be there in the premarital, but some elements of ADHD may be there. Then, of course, mania, bipolar, we are talking about depression on one side, later going on to mania. There are many drugs, but we will, as a pediatrician, we will only use carbamazepine or oxcarbamazepine. Conduct disorder also carbamazepine. But the wonder drug is for psychosis, risperidone, psychosis as well as autistic things. The adult dose is 2 to 4 milligram. Appropriately, you have to change. Young adults can have the same dose. Now, I am repeating this again. These are the 10 commandments: family life education, immunization, preconception, folic acid, body image, checkup, medical checkup, screening for menstrual problems, screening for mental health problems, sexuality skills, newlywed counseling, and last, self-counseling. So one more thing, I am not put the slide, but I think it's important to teach them. That is about, there's something called Partner Assessment Scale Trivandrum. He's a professor of gynecology, professor of nursing, has done PhD with me, come out with a large scale validated PhD, has been awarded. But I have converted that into 7 items, simple thing that we can use. And this is for actually you people also. Anybody who is listening to me, please see whether how your marriage is. Unless your marriage is good, you cannot be a good pediatrician. Just see how your marriage is. Don't tell me any answer. You just note down. 7 items. Number 1, in reality, with all the good and bad in life, how is your marriage? You will rate it above 50% happiness or below 50% happiness. Just do it now, right now on the paper. Second one is fantasy. Fantasy about your partner, your profession, everything. Fantasy. We all live in fantasy world. Now, remember, reality is something which you cannot change, and anybody try to change. This is what we need to tell the premarital stage couple. Once you make a selection of a person, then you cannot keep on changing it. And you have to accept with the good and bad. The later you accept, then the problem will be there. Till you accept that this is my wife. I don't try to change my father. I don't like to change my mother. I don't like to change my sister or brother, anybody. Why the hell you think of changing your wife or husband only? Unless he is a cantankerous person, throw him out, divorce. That is, I'm not against it. But if you are learned to live, remember that whatever you have is the same. Every partner is the same, except that they may have different views, different approaches, different things. Unless he is a personality disorder person, even a schizophrenic person also can be, psychosis also can be, you can live with that person because he has problem only when he has, give medication, his problem become all right. He'll be so thankful to you, or he or she will be thankful to you for supporting. So remember, personality disorder, of course, it is a miserable story. You better throw him out or her out. You can't do anything about it because personality reconstruction is there theoretically, but it just doesn't work. So that is about. So fantasy is different. At every age, you have different fantasies. Nothing wrong with that. Don't be shy of that. But share the fantasy with the partner and teach them to share the fantasy. If you look something and you enjoyed it, enjoy it together. So there's no guilt feeling. And third one is support. Support may be money support. It may be peer support. It may be family support, in-law support, but you have a support. The problem with the present generation is that they cannot trust anybody. They don't have support. They all live on borrowed money, but once it collapses, there's nobody to hand behind you. And that is the time when you run towards God. Sometimes it may take a long time for God to respond also. So I think that support is important. Fourth one is most important. How do you rate marriage? You take it as a pious, religious, spiritual thing, or just a physical contact. That's all. So if you are taking it that way, then you can keep on changing partners. Otherwise, you say, if I can't get along with this person, I'm not going to get along with anybody else. But I'm again saying, if the person is cantankerous, go ahead and throw him out or her out. That I'm not saying, I'm not against divorce, but once you decide to stay with a person, enjoy. I put it in a different way. If you are I'm sitting in this room, I'm seeing all sort of, giggly voice outside. However much position you are, you will peep through the ventilator outside. Okay, because you want to know what is happening on the other side. That all of us do. We pretend we don't do, but we all will do. But once in a while, go outside and peep through the ventilator to inside your room, inside your bedroom. What you have inside your bedroom is equally as good or even better than anything else in the world. I put it in a different way. My wife probably is not the most brilliant girl, not the most, sweet girl, or most, what we call, beautiful girl, not the most sexy girl, nothing. She may not be. So what? But then she is the only one who is my wife. So she has a special status. I think we must think that way. And then, of course, there is another one called our sexuality, satisfaction, sexuality. Sometimes because of lack of knowledge, we don't know. We don't know what do the girls need. The boy doesn't know what the girl need. The girl doesn't know what the boy need. They only know all the thing. In the college campus, they were doing all sort of ruckus, and they think that is marriage. No, that is not marriage. Marriage is a commitment. Marriage is a commitment. You need to teach them that there is a commitment, and commitment, you never look back. If only I married that one, if only I married this one. No, you have made a commitment, stick to commitment. This I am not talking not only from a religious perspective, from a psychology perspective. Unless you learn to accept what you have, you will never be happy. So then why do people have problems in sexuality? Because there is two types of personalities, taking type personality and giving type personality. The men, unfortunately, are taking type personality. They mostly look at their pleasure, their thing, everything. They don't wait for the girl. They don't think so much about the girl. And that's a huge problem. Whereas if you start thinking for her need, her satisfaction, her pleasure, her orgasm, then what happens is, if you look at it, she will do 10 times more towards you, and you become the most happy couple. I think we need to teach them this. You go around anywhere in the world, you're not going to get more happiness than what you can get in your house. This is an extremely important point. But then you can't blame the people also. Why men are like this? Men are like, in the Diwali days, you put matap, we call it. I don't know what you call in English. You put a light, it will go up to the terrace, a huge noise, light, noise, everything. But in few minutes, it will go away. After that, you put an, any amount of light, it won't burn. Whereas the female is like husk, the husk of the coconut husk or bran husk, whatever it is. You put light, the whole night it will be there. It won't, burn like this. In between, little bit. But in the morning also, it will be hot. It will be hot, even if it's not burning. But unfortunately, who is there to look at it? That is why most often the sexual experts would say early morning is probably a right time to have sex. The reason being, whatever you started in the night, actually she is now getting ready for that. So that is something we need to interest. And the last, of course, the conflict resolving strategies. I think this is important because there's no marriage without conflict. But if you have a conflict, learn to look at from as a third person. Don't look at only from her point of view or his point of view. Look at from the other person point of view. Instead of saying that I did so much for you, I did this for you. Instead of that, you just say, what have you done to me? Even if you shout at me, I will say, I'm not going to get hurt because remember when I needed badly, you did so much, you were with me and you really helped me out. And that is the mantra of success in marriage. And I think we need to discuss openly these things with our young couple, would-be couple, and they will be definitely a follow-up would be required. A phone line will be required. I think I'll stop here because most of, you can go on like that, but I think I've taken enough time. So thank you very much, Geeta. Now you can
Yes,
make
thank you,
your
sir.
comments.
Sir, I think these 10 commandments, if we remember all of us, it will be easy for us to do the counseling work. And I think Dr. Nishchal Bhatt has asked to share the 7 points. So anybody has got any question? Because I am seeing here lot many stalwarts of AHA, Dr. Atul Kanikar. We welcome you. Dr. Swati Ghate is there. Dr. Sushma Desai, Geeta Bansal, Nishchal Bhatt. Many are there. So why don't you have any, if you have got any doubt, you can ask. Unmute and ask the doubt. Sir, can you stop sharing, sir?
Yeah, I will do it. I will do it. I will do it.
Actually, I have written what sir has said, but I'm not sure about the numbers. The first one is, in reality, how is your marriage? Less than 50% happiness or more than 50% happiness? That is first. Second, share fantasies with your partner, age appropriate, maybe initially it will be sexually, then spirituality and all those things. The third one is support of each other, family members and the friend, how much you have. Then rate your marriage. The fifth one is sexuality.
No, before that, concept of marriage, do you take it as a pious religious thing or just a, just a joke only?
So
if you take it seriously, that's the fourth one. Fifth one is
sexuality, commitment.
Yeah.
So it is very well explained by sir that the male sexuality is rocket kind of. It just pushes and then it disappears, whereas the female sexuality kind of long, it is going on till early morning. I'm missing the sixth one. The seventh one is conflict resolving strategies.
One is, you are a taking type or giving type.
Okay.
Taking type means most of the men are taking type by and large, not all, but by and large, whereas the female is more of giving type. So the men try to become giving type little bit. She will respond 10 times positively and the marriage will rock, you will do very well.
Okay.
Yeah, you will become a couple will become an envy of everybody else. That's the point I was saying.
One thing that you shared was, if any one of the couple is shouting, the other person has to remember what that person has done in the past for.
No, I was just saying a nice way, we are, whether it's professional or family life, everybody will remember what you have done for somebody. But they will forget what other person has done to you. So even when you shout, you just keep quiet for a few minutes and say, even if you slap me, I won't get angry. Because when I was in so bad shape, you are the only person who did that for me. So I cannot forget that, and that the fellow will be floored.
True.
Top expert of sexuality, Atul Kanikar is there. Sir, you can give your comments. Master brain.
So, namaskar. I have one simple question, sir. Whatever cases that I am seeing, these teenagers do not have permanence in relationships today.
Okay.
And they don't mind changing partners, swapping partners, having multi-partners. And most of them don't want to marry now. Okay.
Yeah.
What is there in the marriage? That is their attitude nowadays. And even if they are graduates, postgraduates, they say, why to buy a cow for a glass of milk? That's their attitude. So if such a child comes to us, such a teenager or youth comes to us, how do we try to counsel or tell them that yes, marriage is a beautiful thing?
So you going around with girls or boys, that is a different story from getting into a marital relationship. What we need to tell them is, if your parents behave the way you want to behave, you would not have been in this position. So for society to grow, we have been unduly influenced by the so-called Western culture. But actually we blame Western culture, but we don't imbibe the good part from them. Many of them are so sober people, they have family, particularly Europe. They all more than each, they are the family people. I have gone to these places. They are family people. They don't do only the media create a hype that they all just going around and doing it, all that. There are people doing. I'm not saying it's not there. It's not that bad. If you want a society to survive, you have to have certain self-respect, self-restrictions. For example, sacrifice, self-sacrifice. The Eastern culture talk about self-sacrifice. You don't have to eat everything there, for your hunger. You decide, I don't want to eat one day a week. That will reduce your obesity, solve all your problems. Somewhere along the line, you have to learn to have self-sacrifice. Not that if you say they all will listen, because at that age, they want to put it here or there, wherever possible, they will go around putting it. They will be like animal instincts. They may do that. But when you get married, you better stop all that. That's why I said, before getting married, whatever you have done, I'm not going to blame anybody. If you have jumped the wall, go, I have no problem. But make sure you don't have sexually transmitted infection. You decide whether you are ready for a committed relationship. I'm not talking.
What about extramarital relationships after marriage?
I don't believe in that. 100% I don't believe in that. But I won't blame somebody if he's having for many reasons. So when I do counseling,
He or she.
He or she. He or she.
He or she.
He or she. I'm not, when I say he, always she also. What from my counseling, what I learned is many of the couple are willing to forget and forgive. They are not so adamant nowadays. They are even willing to forget and forgive for the sake of the child or for her own sake or his own sake. Don't think men are all doing that like that. Unfortunately, the image that is projected in the media, social media as well as films, everywhere is, you are Mako. You are somebody only if you sleep around with every girl in the world. No, it's not true. That is not the way it was meant to be. Okay, our parents didn't do all that. Not that never happened. There, some extra competition will be there. I'm not saying it's not there, but that is not our culture. Let's go back to that culture. We need to talk to them because there are many more issues. I say now there's another problem that has happened. Everybody is talking about menstrual cup. Menstrual cup. Okay, it is perfect for a married woman or sexually active. But below 18 years, the academy should never support doing that. You have no business to do that. Okay. Above 18, I will not say like that because adult, what you want to put inside your thing. Because I'm so shocked by the way the girls will ask whether I put 1 finger, 2 finger, or 3 finger. What is your problem? Things have come to that stage because these people are told that then only you become real bold, modern, and all. What modern? Modern is not doing all dirty things. Sexual urge is something so important every human being has. If they made a mistake of that, I will not. When I say all this, in my counseling, somebody say, I did this. I don't look at them as bad person and all that. I only talk about the risk factor involved. Okay?
So one more thing, sir.
Yeah. Sir, there are some more questions are there.
Yeah, please.
One last question from my side.
Yes, sir. Yeah.
There are many young people who are recently married. The husband wants a child and the wife doesn't want. Now, how do you counsel these people?
No, that depends on you look at the risk factors for them. If you postpone further, what will happen? Suppose they are very young couple, 22 or 23, let them not have for 5 years. Who is bothered?
30.
30, definitely, if you don't have, you are in for trouble. Tell them you are in for trouble. See, somebody want to jump into the river, you can only say that, make sure there is no, some danger there. There is no.
No, the girl doesn't want. The girl doesn't want.
I understand.
The family wants.
See, I tell you, all these people who appear to be very tough and all that, when they sit in front of the counselor, I'm sure you know it now. They melt away. They melt away. Nothing happens. They will melt. Actually, I use this pass for autism mothers. Last time, out of 220 something autism mothers we saw, 30% had serious marital problem. So before marriage, in the premarital, you tell them, The problem is we are on two sides. Either you don't talk anything about sexuality or you go all out for any nonsense. No, there is a huge role for sexuality, understanding. Somebody had asked a question about other type of sexuality, something. You just, madam can ask the question.
Sir, there is a, Dr. Swati Ghate has asked, sexual orientation is a big part. We should, can we, big part, we should sort out in premarital counseling. So it can avoid many marriages. I think.
No, I have had many cases. I have had many cases. But what happens is, by then their orientation is quite clear. By the time they're ready for marriage, adolescence is different. Young adolescents, they may be social. For example, it's a social thing. You know, they are not homosexuality or something. They are only social, homophobia, whatever we call it. But once you are definitely on this side, orientation of this side or that side, that cannot be usually ego syndonic, ego dystonic, we call. Many of them cannot be changed. But you consult a psychiatrist, talk to them, or sexuality, gender specialist, you talk to them. But after that, you cannot do much about that. But there is a group who is on both sides. But this can, I'll give a story of a girl who actually told me, she's a doctor. She got married after 3 years, she said, I'm a virgin. I said, what is the problem? He is the other type. Yes, you know. There you cannot, you have to talk for the girl and say that go and get divorced. You don't have to waste your whole life for that fellow. But suppose that fellow come to me. Remember, I'm not against him. Suppose he comes to me, then I will advise him what is the best for you. But if the girl is my client, my interest is to protect her interest. That's it.
Sir, the very relevant question, today's live-in relationship.
Live-in relationship.
How are you going to counsel them?
Yeah, my personal belief is absolute nonsense. You want to have all the fun, but don't want to take any responsibility. That's what is happened. I am not for that, but I am not against them. If they have a relationship, all that counselor has to do is, have you thought of the trauma that can happen when you split? Invariably, you will split. And when you split, what physical, economic, psychological, emotional trauma you are going to, if you are ready to do that, there are people like that. I am willing to take the risk. Then go ahead and do it. It's your business. Because they like to have, they don't like to have dosa from same shop everywhere. They like to change it. That's okay. That's their business. I have no problem. But as such, when you talk to a couple, now one of the difficulty is, because these people, loud people, are making so much noise about the modern change that has happened in the world. Let us professional pediatricians join hands with them. If they have a problem, we are not against them. We are there to help them. But we are not going to endorse, as an academy, we are not going to endorse unresponsible behavior. That's all what I say. So in bigger cities, you can't avoid it. I understand. In bigger cities, this is a pattern now.
Yes, but because of the convenience sake, and many of them tell that we are comfortable, and then.
Madam, it is not convenient. It's simply selfishness. Nothing more than. You want to have all the fun, but you don't want to invest your, in that. Just absolute nonsense. And in India, we don't have to support this because people will be talking high about it. No. But that doesn't mean we don't like them or we hate them or we won't counsel them, we won't support them. We will do all that. I have no problem. You understand my point? Don't get me wrong. But I'm saying, on principle, we won't accept. So somebody has said disclosure.
Yes, sir. So many of the yes, sir. One more question is, many young adults do not want to marry because they don't want to commit and are afraid of failure of marriage. Many of the parents bring them to us. What stand we should take it?
Grown-up people, they're not kids. If they're above 25, you need to listen to them. Even while telling them, assess the risk of your decision, but then they have the right to make a decision. So that we cannot go with the parents on that, because they have to live together. You understood? But if you are talking about adolescent, then it's once you are 25, 26, your brain so-called is matured now by and large. So they have the right to take their own decision. Why should we interfere in that?
If there is opposition defiant disorder, if you know that, definitely there will be a problem in the marriage later on. How to counsel about that?
Yeah, but this will come out in many other ways, not before marriage only. It will come out in a very many ways. Oppositional behavior is much more younger one. After that, it will graduate to contact disorder. So that's not a big issue. As far as I see, it's not a big issue. There are some other issues. For example, autism, high functioning autism. Okay. I have had cases where the person is so brilliant, everything is there, but no social contact. The wife is in real misery and all that. A particular case, in fact, I asked them, what is that he likes? She thought and said, sexuality, he likes very much. I said, then what is the problem you can? But he said, sir, when there's no communication whatsoever, how can you even think of that? I don't get into a mood at all. What is the solution? This is a real case. I told her, your baby doesn't eat. Your child doesn't eat. What do? I coax, and coax. I said, okay, for this purpose, you are a grown-up woman. Take him as your child. Coax, it will work. I'm telling you, after 3 months, she has said, next 7 generation, I want him only as husband. Somebody asked a question on disclosing premarital thing. Heaven's sake, don't do it. Whatever you say, and we all say men are very broad-minded, blah, blah, blah. Not at all. We are the most narrow-minded people on earth. We talk all for other people, but when it comes to yourself, you are so narrow-minded. Don't ever unnecessarily say. What happened before marriage is not somebody's business. Okay? But after marriage, he has a right for, or she has a right for it. Are you with me? Because most of the people, I say that it may be good if you can have a person who had not had, but it's a rule now. Everybody is going around. So what can we do?
So there is again, Dr. Balchandran has asked, we cannot file a case against live-in relationship. Today's verdict by C.J. Chandrachud, waste of time for the court.
These are actually, even the court cannot decide on these things because this has a lot of ethical, social, economic, so many aspects are there. Court also, after all, they are also human beings. They can only interpret the rule that is written. But the rules were written in the British days when none of these problems were there. So they also cannot interpret a rule which is not there. But then they use their good sense and say, for the sake of the country, sake of the progress of the society, it may be there. Now, again, when I said don't say disclosure, it is because, we think that we come clean will be good to start with. In a very deep, loving relationship, it may be possible. I'm not against it. But in an arranged marriage, and don't make the mistake of saying something. Because I just give you an example. There was a case where the fellow, even 1:30 in the night, he is asking about relation. She was, wanted to go to sleep so badly. And then she said, somebody has pinched me in and I was in LKG. She thought he'll be happy with that, go to sleep. Middle of the night, he went to the toilet. When she came back, she's a well-built woman and lying on the side. He just saw it where the fellow must have pinched. Imagine LKG, it was skin and bone. Okay. He gave one thunk and the female is on the road. Because that is what we men are. I'm telling you, we men are very, very, very orthodox. The more we say we are liberal, we are not. Not that the females are all, not there. They are also very much orthodox. We have two personalities. One, the personality built by our parents and society, and one, the personality that is built by the, society, current society. So we are struggling between these two. You understand my point?
Yes, sir. I think
deep inside you are like your parent. But the modern society tell you to do everything different. So this conflict is always there. As a counselor, you cannot do anything about it except that bring to the notice of the person. And then they have to take the final decision. Counselor never take a decision. The person have to take a decision.
How to do self-counseling?
Madam, it's a very little long procedure. It will take some time for me to say.
Maybe we need a different session for that.
Different session on self, because I'm working on it, I'm publishing on that. We are doing a lot of work on that. At least I can tell you initial results shows very positive among nursing students for mental health and emotional health. But we did not get that good result in the reproductive health, maybe because they are not so comfortable about it. You understand my point? So the mental part and emotional part, and spiritual part, they have very good improvement after self-counseling. But the reproductive part, we have not been able to show.
Tell one example of how do you do self-counseling? Just one example.
I am the best example
Not
of
heard properly, Deepa.
Deepa is saying,
Can you
give
tell
one
one
example
example
of self-counseling. I am the best living example of self-counseling. 42
Not
years.
One scenario, like
One scenario. Okay.
Yeah.
You look at, you tell me one problem that you have. Emotional problem. You are very meaningful lady. You are very intellectual lady, all that. But you may have some negative in you. Something thinking you can. I'll give an example. Okay. Now, since it's not fair to ask you back question. See, I had deep problem about homosexuality. For last 30 years, I'm sure the seniors know I have been talking sexuality for last 30, 40 years. But one thing I was very, very offended by was the homosexuality. It took one person, Vijaykumar, sorry, not Vijaykumar, Harikumar, who was my student, who has worked all over India on all these sexuality issues. He spent a day with me and he convinced me that just like you loved all your children with autism and other problem, these are also people like that. So you don't have to have negative. Okay. But then that is his advice or his guidance. But then I worked on that feeling again and again, thought of myself having this problem. How do I expect others to treat me? You understand my point? So then it becomes self-counseling. Otherwise, it is his counseling. He only gave me the background information, but I got convinced so much putting myself into that shoe and say what I'll be feeling. And now I am most comfortable to homosexuality or anything. You understand? So
yes, this is a very important life skill, sir, for us, empathy.
Yeah, empathy is definitely there.
Any more questions are there? Internal dialogue.
Oh, very good, very good, very good. Nichal, that you are absolutely right. Absolutely right. The whole there are many, many issues on self-counseling. And one of them is what you said, your internal, dialogue.
What I usually understand by the self-counseling is something which has happened outside. How I talk about that with my own self creates my reality of the world. If I can take care and being aware minute by minute what I am talking to myself, that gives me a lot of awareness about what is going on, because my thoughts creates my feeling creates my experience of life. So if I can be comfortable and taking care of what I'm thinking second by second, minute by minute, that gives a lot of present and experience of life, which I can create whatever I want to create out of it.
I have made 10 commandments for self-counseling. And the first one I will say, it is that you may bluff to others, but don't bluff to yourself. You understand? You may bluff to others. You may have to bluff, however good you are. Like that, so many. Second one is, suppose you abuse me. I'll get a little upset, but I get upset only for 30 seconds. Then you shift to cognitive pathway and say, did I do anything wrong? Then I'm sorry. If I didn't do, go to hell. Who is bothered?
Yeah.
Like that, there are 10 rules. I made 10 rules.
There is one very good dialogue by Amitabh Bachchan in one of the movie, Sochoge to lagegi. Everything is in my thoughts. My experience of life is in my thoughts. But majority of the time we think that my thinking is automatic. But if I can control those thinkings by taking a pause after something has happened outside, I can definitely respond very well rather than reacting to the situation.
So the problem is at that young age, they may not have that capacity. At this point, I can tell you, my last enemy also I have patched up. Enemy means not that way, emotional thing. No, because I realized actually he's not my enemy. Just that he didn't like something about me or something it happened. So I went myself forward. That is also part of self-counseling. Say, instead of blaming you, I take the blame. Maybe I was not able to show myself in the right, mirror. So that the last person, I am watching you that the last person I have taken this. Somebody asked about porn or something.
Pornography by the partner, how to tackle?
There are three issues here. Actually, there's a good book that has come on Alve. Ashok Kumar has come out with a book, IAP book on not pornography. This thing he mentioned that also, but a lot about these areas, rules and regulations, POSCO Act and all that. But here the question is little different. Watching porn is something every human being enjoy. If anybody say they don't enjoy, they are bluffing. But not at every age of your life. You understand? And not if what you are. If you are into a deep religious mood for quite some time, then you may hate it. You may have nothing to do with it. You understood? But if the partner wants it, poor fellow, let him have his fun. Don't interfere unnecessarily unless he's getting addicted to it. Addicted means, see, everything psychology, there's a rule. I said symptoms out of proportion to cause, I said. Then body symptoms. And third, not able to do his routine work. Here also take that rule, 3 rules. It is out of proportion to his age and maturity that he is doing. Then of course it is dangerous. Second, it has created body symptoms like he is not able to sleep. He is not able to, lot of disturbance. Behavior has changed. Personality is changing. That's the second one. Third one is not able to study, not able to work. Then porno becomes a huge issue. You get the point. Very often, the problem is we are all born to be animals with all animal instincts. We are controlling it as much as possible. There should be some outlet where, at least in private, your animal instincts can be let loose. So pornography is probably helping that. I'm not for it, but I'm saying I'm not against it also. Because some people, it may be required. It may be a sexual, porno also, before you say porno, nudity and pornography are different. Nowadays we are using it common, but pornography means sexual violence, sexual, all that. Okay, but not seeing a sex act is not a pornography. You go to Australia, you can take one ticket and the whole day you can see hundreds of porn movies. Nobody will put you out till you are satisfied, finished. But what happens? You go with the idea, I will sit the whole day, but you won't sit there more than 1 hour. You get so fed up of it. So but next time you may want to go again. That's a different story. So these things these are very private, personal things. So sometimes you may have to give that allowance for personal choices. We should not get into their private phase too much unless it's disturbing the partner, disturbing the children. I had a boy, I'll tell you, I'll end with that joke. I had a boy who said, sir, something wrong with my father. I said, what happened? Are Saab, he has been seeing the same rubbish for last so many months. Whole month he has been seeing. I said, seeing what? Sir, the other movie, I said, how do you see it? I see it through the keyhole. Every day I'm thinking he will change the scene. He is seeing the same thing for 1 month. So that means how much it can affect your child. You understand? You think you are doing in secrecy, but your child is getting affected. So there is a problem. Or and one more thing I'll say and finish it. And that is, recently I had a girl who was brought in the day after marriage as psychiatric to be admitted in mental hospital. The mother knew me very well. He said, I'm not going to take her to mental hospital. I'll come to me. So when I sat down, and really worked on it, actually what happened, this poor child doesn't even know what is sex. She had no idea about all this. And what this fellow did was, he was doing forceful oral sex in the first. Naturally, she gagged, she made noise, she howled, ran out of the house, did all that thing. They said she's mad. But simple reason is, and mind you, they are happy couples now. All that you have to do is that he did the stupidest thing on earth, but that doesn't mean he's a bad fellow. It's lack of his knowledge. Can you forgive him? You understand my point? They are a happy couple now, in spite of all this shock. So things can be changed, not all cases. Majority can be modified, changed by good counseling. OCD is another one, I'm telling you. Okay, OCD is another one. I had a girl who came for premarital. After that, she said, I want to come and see you. I said, come with the mother. He said, no, I will come with the husband. So I told her, what is the problem? He said, poor fellow, nice fellow, no problem. What is his problem? If he touch me, he'll go and take bath. I said, how many hours? Half an hour. How many soap? Half a soap. What is it? OCD. I told her it's only OCD. Why you bother? She thought he is thinking that she is a bad girl. No. You understood? The moment you explain, the matter is over. So, lot of simple things can be done for premarital newlywed counseling.
I think Dr.
Okay,
Deepa, I think any more time is there for us, Dr. Deepa and Dr. Ranjit?
If there's a question, I can answer.
More
Otherwise,
questions are there in the chat box now.
I think somebody has asked, can we have clients for counseling in family and relatives or better refer to others?
definitely better refer to others. Neither they will be comfortable, nor you will be comfortable. Although exceptions are there. I know a pediatric surgery professor who brought his own son for appendix, did the surgery and went home. So there are people who can separate both. But by and large, better to give to somebody else because they will blame you in the end. Whatever you may do, in the end, they will blame.
How do you tackle social media influence in your counseling?
See, social media is something which we have to learn to live with it. The issue is we all think counseling is teaching them good habits, good things, good. No. Counseling is exploring their thinking about the whole thing and trying to make them say what is the safe practices, what is not safe practice. That's why you need to spend a lot of time. You are not putting your idea that it is bad, this is bad, that is bad. You only say that what can be happen, and you don't even say what is the wrong thing that happened. Just like somebody said, one girl came and said she is having some extramarital and all that. So we asked her to tell 10 people who is having and they are happy about it. She took 1 or 2 months, came back and said, sir, I have found about 8 or 9. Not a single one was happy. Yeah. You understand my point? If I say they will not be happy, she won't believe it. Now she is telling me, I found that they are not happy. Understood? So a lot of self-study also has to be done. You cannot, you give and then it becomes advice or guidance only. Counseling is, you only create a situation for that, the context for that. After that, they have to look at themselves. And they have to learn to explore themselves, right and wrong. It's a little tricky, as a busy pediatrician can't spend so much time on all this. We only can give the right and wrong and then send them off. That's why you need definitely a supportive person. Atul has, I think. You have? You have a supportive person?
I have my wife. Even
who you believe is supportive. Who you believe is supportive.
Somebody has asked for how to get an appointment.
Any day, only thing you have to come to Thiruvananthapuram, my hospital. I have built a new child development center in Neyatingara, which is only about 20 kilometers from the city, 22 kilometers. In CDC, we were seeing less than 6-year-old. 95% were less than 6-year-old children. Here, 95% is below 24. And actually, I'm forced to see 30, 35 and all. But I'll officially write 24 because I don't want to say I'm seeing 30-year-old person. So that is there. Anybody can see. Basically, then also remember, I don't give any guarantee. I only say that I can sit with you and explore your thoughts, help you explore your thoughts. I don't say I will give results. But results usually come if you put in your effort.
I think it has made us to think a lot now.
Yes, madam. Somebody asked a question.
Making us
What is
to
it?
think a lot. Who want to comment?
Somebody.
Sir, I'm Dr. Sushma.
Ah,
I wanted
please,
to,
madam.
can you please comment on the disclosure of premarital romantic relationship
Ah.
with prospective partner?
Ah. You agree with me or don't agree with me?
Which point?
Are you saying you don't agree with me or agree with me?
Sir, I agree with you.
No, there are two ways of looking at it. Now I'll tell you what, I'll give you by example. There was a girl who had a sexual contact at class 9, and then after that she has not had anything. She getting married. She's worried that that fellow will find out and all that. So I told her everything. And when I was doing counseling at home, my wife actually see all these children. They'll come and say, "Beta, you want coffee, tea, and all that." And never she has given, but at least that contact will be there. So, you understand my point? They will say, "No, madam, no." But the idea was that she's there. So children will feel more comfortable. Now actually I use my grandchild. She'll come and play with the thing. So that naturally I become a grandfather. You understand my point? So, but one thing that happened, so this child was getting married. I gave her all advice. My wife said, "Are you telling, is it ethical that you are teaching? Aren't you teaching that boy?" I said, if the boy, can you show me a boy who has not put in any hole they have found? Then it is unethical. But to the best of my knowledge, that such a boy is not easily available nowadays. So what is so unethical? Why should the female be suffering for all the thing? And whatever she did, it was below 18 years and she was a child. And you cannot take her to task. As a child, if she made a mistake, I am for her. I am like a parent. I am like a father. My protection is my client. No ethics come there. You understand my point? All these people who talk ethics, they go out, do what God only knows. So let's not talk like that, ethics. But that doesn't mean if you are in a deeper relationship, you don't share all your past and all. But when you share, remember that the person who you think is so open and so this thing may use it against you later. Just be clear that it may happen. That's all. I'm not saying it should not disclose, but disclosure has its own danger. That's what I'm saying.
The last question, how many times you take a psychologist intervention is required?
I've been fortunate to have a psychologist all through my life, although I take my own counseling and decisions and all that. Now what happens is my psychologist do initial workup, but in the end she bring the person to me and I give this one. Because the psychologists, none of them have 42 years of experience. You know, only one psychologist with me, Indira, had 42. Same, we started together in 1980. No, none of these people are old as my daughter only. They don't have that much experience. So naturally, they are good in the subject. You know, they are better than me. They will talk about Freud and all that, but they don't have the grip of the subject, which you get by experience of so many years. So psychologist, but I think psychologist, it's safe on your part to use a psychologist also. And if it is anything dangerous, psychiatrist also. Any suicide, again, I'm saying it's not out of context, but a suicidal tendency, better to take a psychiatrist's opinion, because a child or person seen by psychiatrist commit suicide is very normal. But seen by a pediatrician commit suicide is a big issue. That's the last message.
Medical legal problem happens.
Yeah.
Dr. Atul, you want to ask the question? You can go ahead and ask the question. And this may be the last question, Dr. Deepa.
Can you hear me, madam?
Yeah, please.
Okay, I've been seeing quite a few girls with their parents coming to my clinic. The girls are between the age of say 11 to 15 years of age, and they are being actually, I would say, vultured by these tough guys in the locality, watchman's boy or something.
Yeah, understood.
And then somebody else is taking the video clip, sitting them in the garden, kissing, hugging, and all that. The girl is 13, 14, 15, so she has her evolving sort of sexuality and she is enjoying it. And then she has that particular, filmy type of thoughts.
Understood.
This is the only boy.
Understood.
And the other guy, senior guy, is taking the video and then threatening the girl and the boy and the father of the girl also. So when such a child comes to us, I recently had 3-4 cases in the last 2 months.
You
or
have
so.
childline there?
We have
You
guideline. We have
Remember,
reported it.
message is very simple. If a young boy and girl went out, did something, sex, this and all that, that's not a big issue. The moment there is coaxing, a criminal element in that, it has to go to police, but it may do harm, ultimately may do harm to the child. That I know very well. So it's a very tricky area.
That's
But
why
for your,
I wanted your...
I know. See, I believe it is actually going to do only. The police is reporting to that only will create problem for the child. But yes, but you are a law-abiding citizen here. You have no choice but to at least inform the child line. But you can be supportive to the child, but not when they have a love affair, they did something. That is not anybody's problem. I'm talking about the criminal nature sexual activity. That cannot.
Parents want me to take this thing out of the girl's mind.
No, if you want to learn more about it, the place you should go is every state has social justice department homes for the girls who are abused and this and all. You spend some time with them. I have gone to almost all the houses in Kerala. Cochin, there is Deepa, there is one in Cochin. Okay, I have seen all of them, not now, little long ago. So if you talk to them, then they realize, and I am taking classes for their staff. And what they say is, sir, we don't know so much. These girls actually know so much. They have gone through so much. They start doing again with the younger girls and all. Okay. Yeah, I know that. I said that you don't have to keep a microphone and go around doing all that. You just separate these two into different rooms. If two girls doing same one, you don't have to look at what is happening under the sheet. It's not your problem. But if a younger girl who is not into all this is being utilized, then as a master of the house, you are responsible. Are you with me? Are you with me? That's the message you have to give. All grown up two people who actually have been raped and all that, if they want to recreate the whole thing, let them do it. You're not your bother. You close the eyes, walk the other way around.
It's the age of the child that is worrisome for me.
Not necessarily. Legally, it's the age, but not necessarily. It could be a 15-year-old who is really tough character, but an 18-year-old who will be sitting and crying also.
Many of them have admitted that they're doing it out of peer pressure. All the other classmates are doing it, and then they are teasing me. You are not doing it, so you are abnormal. So I want to do it.
But this was a story in Western countries 40, 50 years ago. Now we are facing the same thing. So let's be clear. That is why I said parents need to be made aware. Children need to be made aware. Let's not talk about right and wrong. Say what is safe for you.
Safe, yeah.
What is safe for you? You want to get into trouble. Who the hell want to get into trouble? So say that better, you are going to get into trouble. Somebody is misusing you. That angle you should say. Don't say right and wrong. That they won't understand at this age.
Thank you so much.
Thanks a lot, sir. I think one more announcement is there. 23rd of March, every Thursday, every third Thursday of the month, between 8:30 to 10:30, Central AHA will have a DIP program on the DIP platform. This time, 23rd March, we are having a adolescent immunization, need of the day. And please, I invite all of you to join. And
8:30.
8:30 to 10:30, every third Thursday, we have got a DIP platform for Central AHA, and we will be having interesting topic discussion with all the stalwarts, maybe different subspecialties also. This time it is adolescent immunization. Dr. C.P. Bansal sir, and one more panel is there where Dr. Kasi sir will be a moderator, and experts like Vipin Vasishta, Indu Sekhar Rao, Kripa Shankar Chatterjee, they are going to be the panelists. And I request everyone to join. Every third Thursday, 8:30 to 10:30 p.m. we'll have a Central AHA program.
How do we get the link? How do we get the link?
Sir, we will send you the link, sir. So, Dr. Deepa, over to Dr. Deepa.
Thank you so much, MKC sir, for sharing your years of experience and expertise with us for so much of time. And big thanks to Geeta Patil madam also for chairing this session so well. And to all the seniors here, Atul Kanitkar sir, Nishad Bhatt sir, Sushma Desai ma'am, everybody who made this the whole discussion, everything very lively and active. Thank you all. Thank you once again. And I would like to give a special thanks to IAP Trivandrum and IAP Kerala for hosting this program and supporting us.
And you give a thank to my wife who tolerated me last 40. All my idiosyncrasies.
Our thanks also to her, sir.
On record, it has been told. For tolerating my idiosyncrasies for last 41 years. No, actually, I'm not joking. All my ideas have come from my family life. And not taken anything from book.
Sir, we should thank Kerala AHA for arranging this program. Something little novel program, little out of way. And maybe we expect some more programs like this in future.
One more point I will say, Kerala government is now promoting this premarital counseling. This week itself, I am going to take the 4th or 5th one today, this week. You know, Kerala government under ICDS, they are doing. I am doing training for supervisors. Today also I took a class, and now and in the Anganwadi workers also they are doing it. So why don't you think about other governments also to do it under the government banner? You know, for ICDS people, that will be a great idea. Kerala is already doing.
That is what AHA should create a module for premarital counseling. So that you can take it to college students as well as the sir, what you are telling is very, very important thing to do. Because as we all know, the life cycle approach is the base behind reducing all mortality rates. So if we can start doing it now, we can have results in 5 years.
Starting from first 1,000 days till adolescence.
Yeah.
The whole thing is go like a life cycle.
Yeah.
Last year, we prepared a module on preconception care. MK sir was the chief editor for that. Himabindu ma'am and took the initiative. That was released all over India, actually.
Geeta madam, आप mute हो.
No, yes, no, she said preconceptional counseling module. Last year we made, I think, national level. I think Geeta was there. No, very much.
Sir, I was there maybe last to last year. IIP Women Wing has taken that.
Yeah, Dr. Hima.
We were there. All we were.
That is preconception care.
Yes. I think RN Sharma sir is there.
Counseling module is not yet.
Sushma ji, you are not heard properly.
Sir, can you hear me now?
Yes.
Can you hear me?
Yes.
Yes, yes.
The module we're talking about women in preconception care and the preconception counseling module specifically is not
What is she trying to tell is there is preconceptional care module is there, but premarital counseling module is not there.
No, it was not there. Premarital counseling was not there. This is the first time I think we have to do.
Yes. I think Noble Publishers is bringing out the book. I think it's already released in Ahmedabad, if I am not wrong. The book.
I think, sir, this Family Planning Association of India has been doing a lot of preconceptional counseling for quite some time. I think 2-3 decades. Family Planning Association of India, sir.
I know. The Delhi persons came last week to visit me to revive and all that. Somehow they are without funds and without much direction.
Yes. Initially, they had come out with this small pamphlet, you know, both in English, Hindi.
Yeah, I know. Deepa, I think we can close it.
Yeah, we can.
Yes,
Okay, thank you.
it's
Good
been a
night.
pleasure, sir.
Thank you all. Deepa, thank you a lot.
Thank you. Thank you.
I always
sir.
say when Geeta
great session.
smile, Deepa smile, my energy comes. Last time also I told her, her smile bring energy to me. Ranjit, correct or wrong?
Yes, sir.
Ranjit, you agree with me?
Yes, I agree, sir.
Yeah.
Your smile brings energy to all of us, sir. Your smile brings energy to all of us.
True, Sushma ji, true.
Thank you so much, sir. Thank you, sir.
Bye. Good
Good
night.
night. Good night.
Thank you very much, sir. We will come out with more such sessions in the future also with the Stalwarts in adolescent health. Have a
Ranjit,
good day.
whatever you want to do in the next 10 years.
Okay, sir.
Okay.
Sure.
After that, you get tired. You know,
Okay.
this is the age at which you should be able to do everything. After 10 years,
Okay.
you start getting tired. I am an exception. You know, like
Sir,
that.
but if there is a passion, it is difficult to get tired. You have that passion around all these subjects. Rather than passion, it is devotion, which I can say that, which is more important.
No, the answer to that is everybody can't be mad in this world. You only have few mad people. You can't have everybody mad in this world.
Thank you so much, sir.
Atul Gupta, sir, good night.
Good
Atul
night,
Gupta.
sir. Good night,
Good
sir.
night. Good night, sir.
Good night, sir. Good night. Have a good day.
Good night.
Good night.
Good night. Then we can. Thank you, sir. Then we can close the session.